Hello, my name is Bob Martin. I am the CIO of WellPath here in Nashville, Tennessee. I'm going to talk to you today about how we use and utilize HIEs inside correctional institutions around the country. So WellPath is a national company. We partner with local and state governments around the country. About 75% of our business is in the correctional space, either in local jails or in prisons. We have about 15,000 employees serving around 300,000 patients every day. We work, like I said, across the country, 33 states and in Australia. Most of you probably have never pondered what healthcare looks like inside of a jail. But a lot of people come in contact with the correctional systems every year. Over 10 million arrests in 2019 across the United States. In Wisconsin, last year, over 129,000 different people were booked into Wisconsin jails. The capacity there is about 13,000. So that is a lot of turns during the year of people coming and going out of these institutions. WellPath serves about a third of those in Wisconsin and in most of the major counties here. This industry was created back in the 70s through a very famous Supreme Court decision, Estelle v. Gamble, which essentially established an inmate or a correctional institution resident's right to health care and established this basis of medical necessity, which essentially establishes that inside the institution, the incarcerated folks are due to what's called a community standard of practice, which means that healthcare that they access inside the facility should be similar to what is available on the outside of the facility. Doesn't mean that everything somebody desires or wants is delivered. It just means that each request has to be evaluated by a clinician and treated appropriately. So mechanically, what that looks like is in a jail. Jails are full of people that come directly off the street. They haven't been to trial yet. They haven't been to a judge. There's a presumption of innocence, right? We all taught that in elementary school. So they come into the facility and they're booked in. Many people bond and leave right away, but many stay, right? Or many are what's called received into the facility. When that happens, within just a few hours, a assessment is done. A receiving screening is completed, generally by a registered nurse, to assess that person's ability to be in the facility, as well as their ability to, or to prevent any bad things from happening while they're there. If someone has got a chronic disease, we want to identify that. If somebody's on medication, we want to identify that. We want to ensure that any emergent and urgent healthcare needs are met right then. For instance, there's a series of medications that we call no-miss meds, right? So that if somebody is taking those, they should not miss one medication that they were due. And this whole process is designed so that newly arriving patients are not a danger to themselves or others, as well as they understand their access to healthcare while they're inside. And, if they have unmet needs, those are taken care of as quickly as possible. Now, in that process, there's a bunch of potential things that go wrong and can go wrong and sometimes do, right? Patients, they've just been arrested, incarcerated. They're talking to an authority figure. They may not be forthcoming with certain medical conditions or histories. They may not remember the names of the medications they're on. They may not even remember the name of their doctor, or maybe not want to disclose that. It really relies on the provider, the nurse or the physician doing that intake to assess serious issues or risks of a highly stressed, often non-transparent patient, right? So a lot of subjective data is gathered. Of course, labs are collected, vitals are collected, things like that. But it's largely a subjective assessment based on the skill of the person doing the intake and their training. And EMRs have a big impact. There's a lot of what we call frequent flyers, folks that come back into the facility. And obviously with an EMR, having the data from past incarcerations is hugely valuable. However, there's gaps in those incarceration periods where there's no data. And many, this is their first incarceration. So those gaps or that missing record can negatively impact our ability to provide care in those situations. So with the HIE, really changes the paradigm. Really when we able to access this outside record, we get an objective medical history data. We can fill in those gaps. What medications are they taking? Did they recently get them filled? Also very important is who they were working with on the outside. Who is their provider? Where did they encounter, come in contact with the healthcare system while they were outside the institution? And it allows us to connect the dots. Without that, it's a lot of phone calls, it's a lot of faxing, it's a lot of email. And at the rate of change that goes on, this could take days to fill in the missing pieces of a medical record. So what we're doing inside of corrections is started 15 years ago, 16 years ago, is EHR centric. So almost 96 or a little over 96% of our average daily population is on an electronic health record. We have our own system. We also use some of the other systems that are out in the marketplace, but we've developed a system that is really focused on jails and the high turnover and the medical needs that are unique to the jail. We talk to the jail management system so that these are the systems where the booking is done, where the person is documented as being a resident in that facility. And we integrate our EHRs to those systems so that within minutes of an incarceration or booking, we become aware of that patient. And we do their receiving screening, generally within 2 or 3 hours of coming off the street. They're in front of a nurse getting this assessment. Immediately when we get that incarceration, we're communicating with WISH, and we collect that data into our EHR so that when the receiving screening is done, we have that outside record right in front of the nurse. It has a great opportunity to kind of change the dynamic that's going on. Now the nurse is confirming history and filling in gaps rather than asking questions. So it gives an opportunity to build trust with the patient. I see you're on this medication. I see you fill it here. I see you've been seeing Dr. Smith. So trust is built with that patient when that happens. So they have a chance to balance that objective data from the HIE with the subjective data of what they're seeing, what the patient is telling them ahead of them. It also makes that connection with the outside provider. So this opportunity to talk, and believe it or not, our providers and our nurses talk with their outside medical providers to make sure that their care is consistent inside with what they're outside. If you're disruptive, we know that is not good for these patients. If we change their medications from this to that confuses the patient. The families may become concerned that the jail is withholding care, which is not our intent. What we want to do is be as closely integrated into the community with that patient's healthcare and that patient's healthcare delivery as we can. And many times, the jail may be the primary provider, especially when it comes to behavioral health. The jails are often the primary provider for this patient. So we've established this network around the country. As you all know that you're here, you know what's going on with HIEs around the country probably better than anyone. Is that it's a disjointed state by state, sometimes locale system where we don't all work together really well. There's a great opportunity as the HIEs mature and kind of establish themselves in a sustainable model for these networks to work together. so that we can share data across markets and across the country as patients move and travel and so forth. We see great disparities between the HIEs in terms of how we identify patients, how we match patients, how they manage their master patient indexes. Our ranges could be from a low of a 5 or 6% match to a high 50-55% match of our patients. Of course, the advent of the Affordable Care Act and Medicaid has had a huge impact, because now this population has a payer. Often before 2014, 2015, these patients never had access. And the databases we would access before, like RX Hub and the pharmacy databases and lab databases, would have 0 matches for these patients, or very low matches. But with the advent of Medicaid expansion in those states that have expanded, there's been a huge rise over the years of these people coming into contact with the healthcare system and receiving care on the outside. So as we see this trend toward the HIEs pulling in the Medicaid data and the payer data into the databases, it's only going to increase that match percentage and help these patients and help the providers like us treat these patients appropriately. Here with Wishin, we've been live a little over a year. We're in 5 counties, adding 2 more right now. Last year, we had about 5,700 CCDs received with a relatively low match percentage of about 16%. So we've got lots of runway to improve. We've got a lot of opportunity to partner with Wishin and with our client agencies on getting data that can help us match those patients and find their records. We know they're out there. We just need to figure out how to get at them and get them into our systems. And I commend Wishin because of their data integration abilities. In many states, not listed on my previous, it's portal only. And what we found is people won't take the time to go to the portal. They won't take the time to log into another system and so forth. So that EHR integration is key to us. And where people are moving away, because it is difficult in many instances, but where they're moving away, it's a lesser experience. So we want more and more EHR integrations, and this ability to federate across states is huge in improving our matches and improving our data set. So thank you very much for having me here today. I really am an advocate and an evangelist for HIEs, and appreciate all that you guys do every day to mature and grow this industry that we're in. Thank you very much.